brain. I'm really excited to introduce our guest speaker, Dr. Sushrusha Arjyal, who is a psychiatrist with a special interest and expertise in sleep medicine. She's passionate about helping people understand that sleep isn't just about feeling rested. It's one of the most powerful pillars that supports our mental, emotional, and physical health. And I'm so glad that it's having more and more time in our sort of discourse about health and wellness, particularly for women. So one of the reasons that we were really keen to speak to Dr. Arjyal is that she's brilliant at making the science of sleep approachable. Through her educational content on Instagram, she keeps things practical, evidence-based, and provides insights that helps people understand why they're struggling with sleep and what they can do about it. And at Pandora Health, we talk a lot about the connections between lifestyle and gut health primarily, but of course it's connected to all of these other things. And we speak about lifestyle medicine. Sleep and mental health are two of the 6 pillars of lifestyle medicine. Social connection is another. And then addiction avoidance is another. So a lot of what we do is really relevant to Dr. Arjyal's work and training. And so very grateful to you for joining us today, Dr. Arjyal. I know you're going to start off with just giving us a primer to sleep and mental health and why it's so important, and sleep and hormones and sleep and women's health. And then I've got questions for you. I'm sure our audience does as well. And then hopefully we can get away with this with some helpful tips. Firstly, just in understanding how sleep shapes our life, but also, I mean, I'm someone who gets nowhere near enough sleep. I've just gotten a puppy who wakes up at night, and so it feels like having a newborn at home again. So I'm particularly grateful, I think, for some of the insights that you'll share today. So welcome again, and I will stop sharing my screen and excited to get going.
Thank you. Thank you so much. Can you hear me, see me, all of you? Yes? Okay. Hi. So I think there is a double kind of. Okay. So I am a psychiatrist and a sleep specialist, and I practice in North Carolina. So I'm very happy to be here, invited, talking about sleep. And today, first of all, let me just put a little disclaimer. This is more for like educational purpose, and this is none of what I say today is a clinical advice. And if you're struggling with insomnia, depression, or any other problems, please do check with your physician for that. But I'm happy to provide with some insights with my expertise. So let's talk about sleep first, right? Why is sleep so important? Because sleep is kind of like, and I keep saying in this in my talks, right? Sleep is more like a fifth vital sign. So sleep is extremely important. As adults, we need about 7 hours of sleep, if not more. Some people need 8 to 9 hours of sleep as well. What sleep does is it kind of restores our memory. It kind of makes us more energized during the day. And there are very scientific facts that prove that sleep is essential for a good mental health and for a good physical health as well. So I will walk you through different stages of sleep. So sleep comes in 4 stages. So stage 1, stage 2, stage 3, and then the dream stage, which we call REM stage. Okay. Stage 1 is the light sleep. This is where people would say, hey, I'm drifting off, but I kind of remember what's going on. I kind of remember you came to my room, and it's when you're trying to fall asleep. Stage 2 is the sleep where people would kind of go more into a little bit towards deeper sleep, not quite deep sleep yet. But in stage 2, we have some elements called sleep spindles. Okay, sleep spindles are our white noise machines. So the more sleep spindles we have, which is the younger age, the less we are prone to outside noise, right? As we age, the sleep spindles kind of reduce, and then people become more aware to the surroundings. They become more like, their arousals are more frequent. So the stage after that is the stage 3, which is the deep sleep. This is where people feel restored. They like, the energy is restored the next day. So the more deep sleep you have, the better you feel the next day. you know. There is a certain percentage of deep sleep, varies by the age. I mean, I'm not going to get to that. But what we need to understand is, as we age, our deep sleep sort of reduces also, right? So the deep sleep in a 20-year-old is way more than the deep sleep in the 80-year-old. So when people are saying, I wake up more frequently, it is actually true. Then comes the dream sleep, the REM sleep. So, what does REM sleep do? Is REM sleep is about 20% in the adults, not in 20% adults, but 20% of the stage total percentage of sleep is REM sleep. So, REM sleep, what it does is it kind of cleanses out your unnecessary memories, and then it makes room for new memories. So that's why we go through so much in life, right? Like all these small events, big events, and then we can still register, so it does the cleansing part, and it also has a role in preventing Alzheimer's. It has a role. So better REM sleep can help you process better. If people get better REM sleep, then people with, like, traumatic events and who are experiencing PTSD are likely to heal better if they sleep better. That's about the stages of the sleep. So we need deep sleep, we need dream sleep as well, and all of these happen every 90 minutes. Okay, so something to keep in mind. And it varies in child, in an adult, and as we grow old, like, the sleep stages kind of slightly vary, and arousals become more prominent as as we age. But sleep is absolutely needed. And so why do we need sleep for mental health, right? Why are these two so connected? So let's take a look at a little bit of different mental illnesses. Let's take a look at anxiety. When people are suffering from anxiety during the day, they are more likely to struggle to fall asleep at night, meaning they have sleep onset insomnia. They're more likely to have sleep onset insomnia. Also, these are the people who would struggle to fall back to sleep once they wake up at night. That is also true. So, something to kind of remember, right? So, I also have students, and when I give talks and I teach my students, I tell them, listen, you have to treat both of these symptoms parallelly, because if we don't treat them parallelly, then we are more likely to sort of miss them, or miss the symptoms, or kind of prolong, in a way, like the suffering because then one leads to the other, right? Untreated sleep will lead to more anxiety. Untreated anxiety can lead to, again, sleep onset and sleep maintenance insomnia. So something to keep in mind. So treating that parallelly absolutely helps. Then let's talk about something like depression. People who are suffering from depression already have very low energy during the day. They are more likely to wake up early in the morning and cannot go to sleep. Or there is a kind of depression which we call atypical depression, in which patients have hypersomnia, meaning they sleep very long, for a very long period of time, do not have energy, and are not able to wake up. So that is also there. So treating the depression and treating the sleep parallelly will also help. Then, so there are symptoms like post-traumatic stress disorder. If someone has gone through severe trauma, they can wake up with recurring nightmares. They can have different symptoms of post-traumatic stress disorder, like hypervigilance, hyperarousal. So for these people also, treating sleep is golden. Like, it helps them so much, and it helps them, and that's how they work through, like, to process their trauma slowly. So sleep is absolutely essential in patients with getting good sleep, in patients with post traumatic stress disorder. Then there are symptoms, mental illnesses like bipolar disorder. In patients with hypomania, mania, they require less sleep, and they still feel very energized during the day, but it's only a matter of time until they crash and go into depression. you know and also, being in that state is potentially harmful, because then people can do so a lot of impulsive activities like, spending a lot of money, driving fast, which can be dangerous. So it is absolutely important to treat sleep in that phase, so that people, then you can focus on treating other symptoms. So sleep is absolutely essential. I mean, these are the times where we kind of, again, like, talk about medication management, and how to consolidate the sleep will be the goal, right? So these are sort of some mental illnesses, like even in patients with schizophrenia, schizoaffective disorder, you have to treat sleep, you have to talk about sleep. So you cannot, like, sort of, we cannot escape sleep in any kind of, like, psychiatric problems. Then now let's talk a little bit about fatigue. Okay, so especially in women's health, what does fatigue mean to uh, fatigue can mean, a different, it can be a little bit different in different individuals. But when you have lack of energy, when you have goals and you want to do things, but you feel like you cannot, you know and there can be so many reasons of fatigue, right? Again, not a medical advice, you definitely should follow up with your physicians. But where I start is from good history, right? You have to understand that individual. What does that mean? I mean, are you overworked? Are you trying to juggle so many things that you really don't have time to sleep more than 3 4 hours, which is we call insufficient sleep syndrome, right? Are you living in a safe environment? Are you, like, trying to kind of, take care of the kids, I mean, do the household work and trying to manage so much that you don't have time to rest? you know so all of these is like, these seem like a very simple sort of questions, but if we don't understand this, and if you don't understand the scenario, what the patient is going through, then it's really not going to help them, right? uh, then let's talk about like the clinical aspect of it too, right? In a way, fatigue can also manifest itself in patients with vitamin D deficiency, problems who have problems with thyroid, people who have vitamin B12 issues, right? You have to check the B12 as well. Then talking about like the hormonal changes, I just gave a talk to a different company in like about the hormonal changes that we go through as females, and when we age, right? With the drop in estrogen, drop in progesterone, insomnia is more prominent. There is mood irritability, and I'm not saying it happens to everybody, obviously, right? But there is an explanation, the hormonal explanation of why people do feel irritable, why people do feel like they cannot sleep as they age. Especially I'm talking about females in terms of hormonal changes. And then, not gender based, if you talk about like, sleep and illnesses, like physical illnesses like diabetes, people who sleep better tend to have better control of diabetes. Again, not saying you don't have to take medications prescribed by your doctor, no, but the control of sugar, the regulation of diabetes, and the prognosis is better if you sleep better, you know and similarly with so many other, like, I mean, not sleeping well can increase the rate of your cardiovascular events. And these are all research based, evidence based, sort of findings. So yeah, sleeping better reduces the risk of your cardiovascular events. That's also true. Sleeping better helps with memory consolidation, reduces the chances of dementia. Again, chances, right? I mean, it's not like, that is the only factor. Insomnia, if you look at it, like, is, I mean, sleep is such an amazing, amazing element if we focus on sleep and healthy sleep, that it reduces chronic pain in patients suffering from chronic pain. So there are so many factors, right, that are kind of like intertwined with the sleep world, the physical, illnesses, the mental illnesses, and the other comorbidities as well, right? So that's about our sort of how sleep affects the physical and mental illnesses in a very short, sort of like rapid fire rapid fire sort of round here, right? Now let's I want to talk a little bit about sleep disorders, since I'm a sleep specialist. We talked about how mental illnesses affect sleep. Now let's talk about how sleep disorders affect the mental illness, the other way around. The most common sleep disorders, one of the most common sleep disorders would be insufficient sleep syndrome, when people are working so much that they don't have time to sleep. So if a patient comes and says, okay, I am sleeping, I have 4 hours to sleep, I'm extremely tired during the day, cognitive behavioral therapy of insomnia, or putting them on sleep medications is really not going to help, or might make the symptoms worse. We will have to figure a way out to, can you get more than 4 hours? Is it possible to clear some of the responsibilities? And that's where um, getting a good history, getting family involved if patient consents, right, and helping them through that process is going to be really, really helpful to the patient, rather than just prescribing medications. Then there are certain sleep disorders where patient would sleep for maybe 8 9 hours, but they do not feel rested. They might snore heavily, they might snore lightly, but the typical history is, I don't have problems falling asleep, but and staying asleep sometimes, but I wake up multiple times at night. I can go right back to sleep. I feel very tired and exhausted during the day. Sometimes they feel sleepy, sometimes they are sleepy driving, sometimes they avoid driving long distances because they are so sleepy. Sometimes they are not sleepy, but they are extremely irritable, and they are like, I cannot catch up on my work. I have a 15-page to do list and I can't seem to get through it. Um, that can be the history too. So when we kind of reassess all of this, and if the patient has snoring and fatigue during the day, sleepiness during the day, they might have sleep apnea, because that's what sleep apnea does. Is it has so many arousals intermittently, and because the airway closes intermittently, people always wake up to breathe, but what happens is then it fragments the sleep, and people with sleep apnea don't get as much restful sleep as they should, and they feel tired during the day. How does it relate to mental illness? Is people with sleep apnea most likely end up being either like having low energy, fatigue, and some symptoms of depression, right? Because then you're so tired all the time, or they're just maybe treated as someone with depression. It also happens that nobody has gotten the sleep study, they don't know they have sleep apnea, and then they get treated for depression. But then guess what, they actually have sleep apnea, and if they have sleep apnea, if you treat that, then you could probably focus on how much of it was depression. I mean, maybe not ruling out it all together, but so that can also happen, right? There are certain so, like I mentioned, see, insomnia like good sleep helps with emotional regulation. So if you sleep poorly, your level of anxiety during the day tends to go up. If you sleep poorly, even, I mean, we could all probably relate to this, that the same problem during the day becomes a little bit more stressful if you had poor sleep at night. Whereas if you had good consolidated sleep, you're like, okay, I got this. It happens most of the time. So emotional regulation is very much dictated by sleep. So if you get good night's sleep, you feel better during the day, mentally and physically. And same, like I mentioned, with chronic pain and things like that, right? So as we go towards more sleep disorders and how it helps with mental disorder, is let's talk about something like restless legs. When people have restless legs, they have such urge to get up and keep moving around. It disrupts the sleep. And guess what happens? Like, it kind of like makes you tired, fatigued during the day, sleepy. It makes you more irritable. Similarly, sort of other sleep disorders like narcolepsy. What narcolepsy does is it makes you feel very tired, extremely sleepy during the day. It is a disorder that needs to be, and among all other sleep disorders, has to be evaluated by a sleep specialist, has to be diagnosed. Perhaps some of them need sleep studies, right? Obstructive sleep apnea, narcolepsy, some need home studies, some have to be in lab study, right? So we have to make a proper diagnosis and assessment. But these are the factors that overall regulate your mood during the day, affect your mental health, affect your functionality at work. So something to keep in mind. Now, on that note, let's talk about circadian rhythm disorders also. Okay, there is a difference between insomnia and circadian rhythm disorder. What it means is some people sleep less than 7 hours, right? But some people do sleep 7 hours, but not in the quote unquote right time. Meaning, if you go to bed late and wake up late, like go to bed at 2 a.m. and wake up around like 9, 10 a.m., it's still a good number of hours of sleep. But you're not, really sleeping at the proper time, so to speak. And people tend to get very stressed about that because they have to get up, go to work, send their kids to school and all of that. But this is a circadian rhythm disorder. Similarly, as people age, they tend to sleep earlier, wake up earlier, maybe doze off around like 4 p.m., and then wake up at 3 a.m. and cannot go to sleep again. So that also happens. So these are different sorts of sleep disorders that we treat and that affects your overall functionality. But these are sort of treatable conditions. So now I know we kind of are heading towards our interactive session. So let me leave you with a few points, right? As at home, what can you do? First of all, again, I'm being a female physician, and I know that we all have so many responsibilities. We are wearing so many hats, and we're doing so many things at the same time. First and foremost, validate yourself. Please listen to your body. If your body is saying you need a nap, you're not making it up. You're not being lazy. There is something going on, and then some things that we, I mean, like you mentioned, the something that we can do would be to regulate our time, to create a clear structure for the day. Wake up at the same time if possible. Create like that, time to prepare to go to bed. Like, if your bedtime is, let's say, 10 p.m., then I would prepare to go to bed around 9 p.m. Doing all of your daily activities, turning, making the bedroom environment cool and dark will really help. Not using electronics about 1 hour before bedtime will help. Reading that good old book, the tangible sort of, that will help. Listening to audio books, and also, journaling helps. But then depending on like what you want to, like, we probably limiting it to a page or so also helps, right? I wouldn't read like modern mysteries or you're welcome to do that, but something that's a little bit not so stimulating, you know that will help. If someone says, oh, it calms me down, by all means. I mean, it's very individual too, right? I'm not taking that away from you, but these are the things that will help. Limiting your caffeine intake definitely helps. Meaning, in the morning, if you want to kind of limit the caffeine, and then just keep it to the morning and not, like, extend it to the day or the later part of the afternoon, that helps. Definitely avoiding substances helps, right? Like alcohol, any kind of smoking, any other substances will help with the sleep, because none of them have been shown to increase your deep sleep or dream sleep. Rather, it kind of reduces the deep sleep, dream sleep, makes people more anxious, and then any other substances, like, I mean, are detrimental to your sleep. So just keeping that in mind. And I really loved how you beautifully mentioned the social connection. Yes, we all should sort of strive to actively create social connections, have people who you can go on a walk with, people who can pick up the phone like and say, hey, I really had a bad day at work. And that kind of exchange is the meaningful exchange, and meaningful relationships do really help your sleep. And also, I mean, in a very simple way, right? We don't even have to go that deep. If someone has a, let's just say, a friend who they can hike with, they're probably like in the morning, they're probably likely to sleep on time the previous day, right? Because now you have a structure, you're looking forward to something healthy, and then you feel good about it. And then that creates because you have like now exercised and done some really healthy living that day, you're likely to sleep better the next day as well, right? So having those meaningful relationships is definitely the essence of good sleep as well. So these are some tips that you can use, but I always tell people again, I'm not trying to put one more thing in your plate and saying, oh, you should do this. Please seek professional help. If you're suffering, please seek help. Please get a consultation. At least you will know what's going on, you know and then you can also kind of share the responsibility with your physician and say, hey, I know I'm responsible for the structure and everything, and I will do that. And rest is up to what is the diagnosis and the treatment and everything else. So that was like those were a few nuggets for today. I'll welcome questions now. Thank you.
Thank you so much. That was great and so informative. I have so many questions. And for anyone else who's listening, please feel free to put your hand up if you have a question, and and then you can unmute and ask. But so just a few things that you mentioned earlier on. So I had not heard about sleep spindles. I think that that's so interesting. I have heard about the connection between age and sleep, and exactly as you said, that I remember my parents getting up early, and I was always like, how, like, why would they want to get up so early? And so, you maybe talk a bit more about that. Is it something that are there any sex differences? You talked about estrogen and the link between estrogen and sleep in women. So yeah, maybe just talk about sleep, and firstly the sleep spindles. I'd love to hear more about it, and then sort of sleep as we age, and then sex differences with sleep patterns.
Yes. First, here is a confession, right? We don't know like 100% about sleep yet.
Mm.
So what we know is, and there's like new information coming, but what we know so far is sleep spindles block the noise from outside. It's like again, like a white noise machine kind of. And if you look at, like, when we read the sleep studies, we can see that there are certain medications, and I'm not going to name medications here, but they do increase the sleep spindles. So when we kind of prescribe that to the patient, and they'd come and say, hey, Dr. Arjal, I slept well. I'm like, okay, yes, that is, but again, a disclaimer: for chronic insomnia, CBTI is the mainstay of treatment. So I'm not saying, like, but then there are so many different intertwined sleep and psychiatric complexities that present in the clinic that we have to make decisions accordingly. So sleep spindles do reduce over time with age. And that's why when people say, I don't sleep as well, I'm aware of. And you'd also probably hear this like a lot. The family members would say, I know you were sleeping. And that person would be like, no, I was aware of everything. I didn't sleep. you know I didn't sleep at all, and because I could hear. So that is one of the reasons of that is the sleep spindles. Okay. Then the other reason is the deep sleep, also N3 sleep. You talked about, like, the question about the gender differences. So the estrogen and progesterone are helpful. Hormones are helpful in sleep, but during the menstrual cycle also, because of the fluctuation, number one, and then during menopause, because of their fluctuation, they tend to contribute to disrupted sleep. And I'm also going to upload that other talk on hormones only to my YouTube channel. So people are welcome to go and kind of take a look at it and like look at the whole talk. But in just because of that, what happens is as people age and as females, especially, their sleep becomes disrupted. The cortisol goes up, estrogen goes down, progesterone goes down, and then it kind of, you know, kind of affects the sleep in an adverse way. And also, if you look at it, like you're getting that kind of fluctuation monthly, and then you're getting it in the lifespan as well. So we are dealing with a lot. We're dealing with a lot. And when you talk about gender differences, I'll tell you a little bit about like sleep disorders. Like, for example, sleep disorders like obstructive sleep apnea tend to be more in males until females hit the menopause age. So as they are at menopause, then the risk becomes the same, but the presentation might be different. Because again, the prevalence of anxiety is a little bit more, like generalized anxiety disorder in females, so that tends to kind of mix up with insomnia. So you might not always see someone who's snoring heavily and sleeping all the time. You might see people who are more irritable during the day, have anxiety, mood symptoms, and they tend to not be diagnosed with sleep apnea. But that's when we kind of have to take the good history and diagnostic test. And similarly, so it depends on in different stages of the life as well, and that's how it's different. I hope it answers the question.
Yeah, that's very helpful. Thank you. And then I wanted to also ask you about, so you spoke about the three stages happening in cycles of 90 minutes. And I remember reading about people centuries ago sleeping at different times of the day. So they would, sleep and get a bunch of sleep in the afternoon, and then a bunch of sleep later again at night. Does it matter when those 90-minute cycles happen, or does it have to happen all in one go?
Doesn't matter. Doesn't matter. That's why, we do say don't take daytime naps if someone is suffering from chronic insomnia, of course, because if you sleep during the day, again, it defies the recommendation of have a structure. But if you have a structure and you have been sleeping 30 minutes during the day, and it has worked perfectly for you, there is nothing wrong with that, really. And that also helps divide the sort of day into two halves. And then if that's and again, you bring a very good point, right? Sleep is not something that is like one thing fits all, sort of, right? Sleep is something that we need to a great extent, again, embrace our pattern. If someone has a little bit delayed sleep, like they don't really like to go to bed really early, and it has worked for them, I won't try to fix that. I would just leave it. So yeah, it is the same. Sleep is sleep, it doesn't matter. And that's why when people have circadian rhythm disorders, they really don't have this like cardiovascular risks, and as patients who actually have insomnia. But why do we treat that? Is because of the functionality, right? They probably won't like getting up like in the afternoon. So we try to help them for the functionality, and so that they can have more like social connections.
That it makes a lot of sense, and I think it also helps. So the way that you talk about sleep and interventions and what to do about it, I think is helpful, because what I've seen is that people don't get enough sleep, feel fatigued, then feel stressed about not getting enough sleep, and interventions that don't work. And so I like that you talk about there are different ways to get sleep. There are different ways to treat different disorders or sleep issues. You spoke about cognitive behavioral therapy and therapeutic interventions versus medication. And so I'm hoping that also this conversation will help people understand. And we post these on our social media and on our community, will help people understand that there are lots of things that you can do. And it's not that I'm not getting enough sleep or my sleep patterns have changed. And, now I'm going to have, issues with my health, or longevity issues, or I'm going to feel like this all the time. I think it's helpful for people to understand that there are many things that you can do and many ways that you can get that sleep in.
Yes. And also, if you have questions, I mean, I would get a consultation with an expert, because that relieves the anxiety. And one other thing I'd want to mention here while I'm, in this talk is also, and which I see in my clinic as well, sometimes sleep is a collective responsibility too, right? Especially talking about mothers, if we are saying they don't have sufficient time to sleep, it becomes a responsibility for everybody to kind of give them a few hours so that they can sleep. So it's sometimes I don't even like say, oh, you have to sleep 7 hours, but try to understand if that person has 7 hours in the daytime to sleep, in the 24 hours to sleep. uh, Similarly, sometimes it's funny, like, but sleep becomes more like a couples therapy too, because if one person is snoring heavily, the other person is very likely to develop insomnia over time. So please get yourself evaluated and treated if you have sleep apnea, which is a very treatable condition. And it helps with snoring and everything. If one bed partner has a bad sleep hygiene, it tends to affect the other one too, right? So in some ways, we have to involve the bed partner, we have to involve and do that counseling as well, that can we give them 3 more hours so that they can sleep. Who is doing the childcare part, what is happening, all of these goes into sleep as well. And sleep disorders, I mean, I haven't mentioned this, like, but and again, there are so many sleep disorders, it's not easy to cover in like one session. But there are some sleep disorders which we call REM behavior disorders, in which what happens is a person acts out in their dreams. Because they act out in their dreams, they are flailing their arms, they are kicking, they are shouting, they are, so the bed partner, the spouse, is very likely to have disturbed sleep. So putting them on more and more medications is really not going to help if we haven't obtained the history, right? So in some ways, it is a collective thing as well with the family. And when we talk about functionality during the day, does that person have 1 hour to exercise, right? So some of the things, as like, as a society, we should think about, right?
Yeah, two great again points and suggestions. I had never really thought about sleep and responsibility for kind of caregivers at home being part of the family and family responsibility. I love that, and I think again just so helpful. I think for a lot of women who typically when you've just had a baby and it's a newborn, people will sort of recognize that. But I think again, because of the role that women play as caregivers, if you're not getting sleep later in life as well, or even when your children are older, your family is older, the point that you make is absolutely, it's so spot on that everyone should be looking to provide support.
Yes.
I wanted to ask you about fatigue. It's a word that we speak about more and more. It's become sort of part of just the cultural zeitgeist around understanding that people can feel tired all the time. It's often associated with women's health and perimenopause and menopause. When do you know when you're fatigued? What is it? Is it a few nights of bad sleep? Is it just consistently waking up feeling tired? How do you know where to draw the difference, or where to draw that line between there's something happening and I'm just not sleeping well, versus this is actually fatigue and maybe something that I should try and get medical support or advice around?
Yeah, it would be generally how they present patients in the clinic would be, I'm exhausted, I am irritable, and I'm not able to function properly. So again, it's a bit of individual thing, but if you have sleep disruption for even, let's say, a week or two, and if you're tired during the day, and we know our body, right, we are not able to, like, if you have less energy, if you're not interested in things that you used to love, and also I would take a bit of feedback from family members also, If people are saying, hey, I don't think, again, for that we have to have very meaningful social connections, right? So like, you're not yourself, something is not right, I would get it evaluated, again, from the endocrinal perspective as well, you know and from social perspective, from mental health perspective, I mean, physical. So yeah, I wouldn't hesitate to go and get myself evaluated. And at the most, what would happen is you'd know the differentials, you'd know what is not there, you'd know what has been ruled out, and then work towards that.
Thanks. Simpira, you have a question, and then Raisa, you have a question as well. Simpira, do you want to go first?
Okay, can you hear me?
Yes.
Yes.
Thank you so much, Dr. Arjun, for this informative workshop. The question that I have, you spoke about different stages of sleep, and the last stage is the dream sleep, where somebody, where the I guess the brain is cleansing old memory and preparing for new memory, and preventing of cognitive health. And my question is, if somebody is experiencing um, very vivid dreams or sleep paralysis or things like that, is that a good is that an indicator that they are not sleeping well, or they're actually in that dreamed sleep?
So, see, in dream sleep, that's a great question. Dream sleep, sleep paralysis does happen, and which is a protective phenomenon, because if we call it atonia during dream sleep, meaning you're not supposed to run and chase the tiger if you dream about a tiger. You're
Mhm.
supposed to be sleeping, right? In some disorders it kind of gets disrupted, but when do people experience sleep paralysis is when they wake up in the dream sleep in certain disorders. For example, it can happen in insufficient sleep, it can happen in people with sleep apnea, it can happen in people with narcolepsy. So if you're experiencing recurring sleep paralysis, that is not normal and it is frightening, when you're so what sleep paralysis is when your mind is awake here but you cannot move your body. So it's momentary, but it is still very anxiety provoking. So I would seek help, I would get a consultation from a sleep specialist, see if you need a sleep study, and that kind of thing. So getting sleep paralysis regularly is not something that we should experience normally.
All right, thank you so much. And then the next question that I have is it okay to, during the week, you have so much going on and you maybe sleep for 4 hours or 5 hours, and then catch up on the sleep, on the weekend, like sleep the entire day?
Ideally 7 hours a night is what I would recommend, and that's what American Academy of Sleep Medicine recommends. So the answer would be no. You should get, and again, like considering all of the factors that we talked about, right? Again, I don't want to like pressure people and say, oh, you have to get 7 hours, because then it can be anxiety provoking. But if you look at the data, right, 7 hours of sleep every night is what would be a healthy sleep.
All right, thank you so much.
Welcome.
Hi.
Hi.
So, Dr. Archal, my question was similar to Superior's about the sleep paralysis and sleep apnea. And yes, okay, I understand it is a problem now. So, if it's happening too frequently, help should be sought. What I also wanted to ask is I've got MS. So, I get at least 7 to 8 hours, but only of sleep per night, but only 2 or 1.5 hours of deep sleep, and then perhaps 1.5 to 2 hours of REM. Is that sufficient? Is it too little? Because I wake up feeling very, very fatigued, but I've also got anemia. So is the anemia related to, is the fatigue related to the anemia and MS? Is it
Again, like in talks like these, I kind of refrain from giving personal
Yeah.
advices. So I would suggest that you should probably check with your physician
Okay.
for for the specific advice of what is happening
Right.
to you. But
Okay.
overall, I'll say this, that proper sleep also kind of boosts your immune responses,
Of course.
and
Yeah.
people with different kind of problems with the immune deficiencies also
Mm-hmm.
need, like, and those could be contributing as well. But that's how the connection between sleep and immune response is, that it activates T cells. It kind of like boosts. So a good sleep will boost your immune system. I'd leave it at that, but please check with your doctor for the personal advice. Okay.
Thank you so much. I'll definitely mention that to them. Thank you, Dr.
Thank you.
Arjal.
Simpiwe has another question.
I do have another question. This is just for our audience. Some people, they might listen to this or watch it and think that, okay, I think I have a problem, but they are adverse to wanting to take medication. Is it possible to um, find ways to consolidate sleep and uh, fix sleep problems without having to get onto any kind of medication?
Absolutely, yes. So for chronic insomnia, actually, medications are not recommended. For chronic insomnia, the first line of therapy is cognitive behavioral therapy for insomnia, which is a therapy where people would sort of track their sleep and work with the therapist to consolidate the sleep session by session. So it is absolutely possible. But there are scenarios, again, with the intertwined sleep and psychiatry with individual patients. Yes, medications are also recommended in some scenarios, but not for long term and not for chronic insomnia.
All right, thank you so much.
Dr. Arjal, I'm looking at time and I've got a few more questions, so I'm going to try and ask them quickly. So I wanted to ask you about sleep myths. So are there any myths that you hear often that you would like to try and debunk about sleep?
One thing in sleep, it's not a myth, but like people generally sleep generally, they sleep better than they think they are. Okay. Because what happens is there is something called psychophysiologic insomnia, meaning when people get anxious about sleep, then that's why I refrain from kind of telling people without knowing their circumstances, like this is what you should do, because what happens is that is going to provoke anxiety, and that will impair their sleep, because anxiety and sleep don't go hand in hand. They are actually, like, they contradict each other, right? More anxious people are, less sleep they get. So there is something called psychophysiologic insomnia, in which what happens is people are so worried about not sleeping that they actually don't sleep. So that also happens, and we have to counsel, again, not not saying that everybody who's suffering from sleep disruption will sleep better, but this also is sleeping better, but this also happens. And how do we know? Then we kind of like track the sleep, we rule out other everything else that we talked about, right? But then it also happens, and that's probably, I mean, you could call it a myth, but that's what I can think of right now.
Thanks. And then I wanted to ask you about research and if there's any research at the moment around sleep that you find really interesting. One of the things that I'd seen was about a pill that you can take that allows you to sleep less. It seemed to be research, so not anything that's necessarily sort of in trials or in the pharmacy being actively prescribed. But is there anything that you've picked up that you think might be if a game changer in this field if it actually comes to light?
Some of the researches that we're looking for, see, when we're talking about sleep, right, insomnia is an independent risk factor in patients who are suffering from suicidal thoughts. Okay, meaning sleeping less can sometimes trigger those thoughts. So as a sleep specialist, as much as I believe in CBTI, we also have to kind of understand that sometimes people do need medication, especially in acute phases. So I kind of tend to be on a lookout for, like, what other medications are coming up, so that we can provide some alternatives in acute cases. So that's something that I'm interested in. And like we're, again, not talking about specific medications, but definitely those are something that I'm looking out into. And also providing people with more definitive answers of, like, you know is it 7 hours, or can someone like 9 hours, where is the and a lot of unanswered things about sleep, right? We have a lot of unanswered, so why do people sometimes feel rested when they sleep 7 hours, but why do some people need 9 hours? And they're telling you, the patients are telling you, right? But AASM has some guideline about what hours of requirement are. That is something that, like, again, like sleep medications, new innovations in sleep is something that I'm always on a lookout. For example, new treatments of sleep apnea, because it's a very easily treatable condition. And if new treatments come up with sleep apnea, especially if it doesn't involve, which CPAP is a good treatment method too, but like alternative treatment methods, because then you can present those methods to patients and sort of improve their functionality.
And I mean, you mentioned sleep apnea. One of the questions I had is around, how common is it in treatments? And to your point, one of the big associations is weight and, and weight management, how the position people are sleeping in, and then their medical treatments and surgical treatments. So yeah, I think we should have a follow up, because there's lots to kind of dive into around the specific conditions. In the bedroom, you mentioned getting your room dark and cool before going to sleep. Are there any other things that you pick up that can be culprits that people are not aware of? I mean, having your phone right next to you, I know, is one thing that can interfere with sleep. Is there anything else?
So one of the things that I would suggest is, if you don't get sleep, staying in the bed for longer. You know how people would, we usually think that waking up and getting out of bed will break the sleep cycle. It's quite the opposite. The longer you stay in bed trying to fall back to sleep, the harder it is to fall back to sleep. And this is one of the components of CBTI, actually, that people should try to use the bed just to sleep. And if you don't get sleep, maybe just go to a chair and read. And that way you're training your brain to think that bed is to sleep, and you cannot work on the bed, you cannot use your laptop, electronics, and you cannot just lie down and think about sleep. Because what is going to happen is, if you lie down and keep thinking, people generally think about unfinished work, unpaid bills. It provokes anxiety, right? So the best thing to do would be, and I know it is hard, it is not easy to get out of the bed if you don't get sleep.
And then to end off with, I want to ask you about just one thing that people can do within the short term to help with their sleep. Again, you've made really good points about it being individual, and the importance of, if you feel like this is an ongoing issue, seeking proper medical support and medical help. But are there tips or things that are very kind of practical that people can take away, just from this session?
The practical things would be, again, have a structure to the day, have at least 30 minutes of exercise during the day, build some meaningful social connections. We don't need many, but, like, people who can listen to you. And then avoiding bad habits, as we talked about. And in the end, what I would say is, if you can not worry about your sleep, that will be helpful. Because sleep is something that, if we treat all of that right, it generally comes to us when we're not anxious about it, which is the paradox, right? So yeah, I'd leave you with that. And please don't think that, again, not to kind of, please don't think that you can do it all by yourself. If you cannot do it all by yourself, it is okay. It is okay to seek help. It is okay to kind of work with a therapist or a psychiatrist or a sleep specialist. So yeah, recognizing those signs is very important.
It's a great takeaway. Thank you. Thanks very much again for the session. So many insights. I'm really excited to look back at it because I think that there are just so many really, really important and insightful nuggets that I'm looking forward to kind of taking out of the conversation and sharing with our network. So thank you again. We look forward to having you on our community and doing another talk. And again, there's so many different aspects of sleep that we can go into. Really appreciate your time. And thank you to the audience and for asking, and our community members for asking great questions. And Dr. Arjyal, we look forward to having you on again and hope everyone enjoys the rest of your
Thank
weekend
you very much.
of it and gets good sleep tonight.
Thank you. Thank you for having me here. It was an interesting discussion. Thank you for all the questions, and I look forward to keeping in touch as well. Thank you. Take care.
Thanks so much. Bye.